So
they have to clean them.
madam, see what we have to do. You fix a date for the village health committee, water sanitation committee, and let us roll out. So that October, November, December, we can have a 3-month systematic action plan. See, it has to be done every 15 days. See, this discipline is not going to come overnight. Washing of the hand, during COVID we know how discipline came, how to wash your hand. So it created. So same way we have to create a culture in this place. And secondly, we do not know how many workers are changing. So, no. If the worker comes now in August, will he be there till December? Will he go, another worker will come. So we have to see now that we are spending awareness time on the workers at least should be fixed for 3 months. You
They
get
are
it?
fixed just for 8 months.
Let us not generalize. प्रत्येक बोट होणारा खबर हा आपल्या लेबर पिसून अडवून जाय त्याच्यावर इट वॉज डिफिकल्ट सो लेट अस नो हाउ मेनी बोट ओनर्स वी आर डीलिंग विथ डज द कलेक्टेड हैव अ लिस्ट ऑफ बोट ओनर्स हैज द फिशरीज डिपार्टमेंट सप्लाइड लिस्ट ऑफ बोट ओनर्स
Today also, sir, because the trawlers have not yet gone out for weather conditions, like ma'am is saying, laborers are still at the jetty. They're just roaming all over the village. So, like we are also concerned with all the robbery. It's not only like it's health, then it's safety. So many issues to
Even
handle.
robberies are taking place over there.
Ma'am, let us not blame. See, it is so very easy to say migrant workers how many years let us not draw those conclusions. Point I am only telling you, do you have a map that is in your ward? आणि कितले ward effect जाता? As far as staying, where are the workers staying? In which other wards they are staying? How many of the rented rooms have been registered in your panchayat? Huh? कितले rented rooms होता? Police verification झाला?
Yeah.
See, you are saying yes, madam. Do you have the data? Your secretary should have been here. See, every room that he stays is a place that has to be dealt with for awareness. Room on राहता. कि हमें कितने posters मागचं पडतं. So lot of things like that. It is not only when he is going on the boat, where he stays. All this data has to be. So mapping is.
Those laborers are staying on the boat only.
No, in fact, she has a valid point there because I spoke to the boat owners. This is just for information which I got very
Because I'm
recently.
also having
So
problem.
what they told me is they are on the sea, they are on land only for around 10 hours or so. So 6 hours for unloading, he told me, then they put ice for some 2 hours and then they're going back. So there is no room or anything
And
provided
now
for
what
them.
happened,
This is what they have told me. I don't know.
One
Because
minute.
they are not
And
government,
if
that's
we
why
do a
it's
site
because-
inspection and show you the number of rooms that are there in her panchayat,
No, that
which are
is
rented.
only loaders are staying.
See.
Loaders are staying, yeah, but not
So
this.
tell me one
laborers.
thing, what do you mean by loaders? Loaders are not connected with this operation.
Yeah, that's
So
their
what I am
operation.
asking you a very simple question. We are talking about this fishing operation minus the chain of command. There is a control chain, no? Nishcha idea and loader ahano. Loader will effect satlo. If loader gets affected by malaria, doctor will say, no, you are a loader, so I am not concerned with you. We cannot do this.
Mostly loaders are staying in this.
So,
Rented.
so madam, what I am saying is that let us have a complete
Yeah.
mapping of the entire operation.
And even
See, this is
parking-
not to blame this fellow or that fellow. We have to intervene because it's a new challenge for us. Diarrhea, cholera, these type of things are water related. It is what you consume, food, water. Okay, everybody cannot buy one bottle of distillery every time. Now, all these things you have to see. So, what is the workforce, doctor, that you are dealing with? Have you factored loaders into your operation?
We are only at the jetty.
See, she's only the laborers on the laborers.
Anybody is here from the labor department? Sir, I am Sarpanch Kavelu Singh. Sir, कोई report आहे paper आहे जे वाचलो हम काल मैं अपना health गेलो. Health house and I got all the details. It is a very serious concern. It is not only the fisheries department. After that, I went to my jetty in Mobar. So I found out, I went to secretary and a village committee. It is totally, nobody cares about it. They don't care about the labor basically. Laborers are living in a pathetic condition. So I think you should assist them, the health department. We cannot blame the health at all. Health is doing their part when there is an outbreak or they make awareness. What about the labor? Like how Mr. Roland आमचे एक ट्रॉलर कडे एक 30 जण असता एकल्या कडे 12 ट्रॉलर आहे कितलो झालो वर्क फोर्स 200-300 in one area. Now what she said is correct. When you are bringing the laborers, see I don't want to call them migrant. They are all Indians, finally Indians. काल एकटो मेलो आणि 10 जण मीटिंग टेस्ट केले in my side, Mogor side. 10 people are tested according to a doctor positive. Now do you have the data? Where are they? They are in GMC. Are they sent back home? The boat owners they just shuffle them to burn out what was. आता मेलो आणि कितले जण मेले एकटो मेला तर कळले आता. Now you have sent to GMC. What about the other 10 cases? Where are they? Are they being treated? After treated, where are they gone? They are just like this. She have a boat. I know she's a fine. But they are just shoveling them from their boat is under cover. Yesterday I questioned them. So I think labor department has to.
at least एक manager
आता वो बायकार मेल्लो नो बायकार मेल्लो तर हांव बोवाड जातालो आता लेबर म्हण आपल्या म्हणटा तशें जाता प्रमाण सेकंड बोटीर आमकां आमचे वेळेर कितले जण शिवावताय बोटीर बेल मोटी आपणाक न्हू म्हणटाय कोणाक तो खबर ना सो आय थिंक वेन द वर्क फोर्स दे आर कमिंग इन आय थिंक दे शूड हॅव द लेबर डिपार्टमेंट इधर दे कम विथ द हेल्थ कार्ड which is from like rural state from their state they are okay otherwise you have to find out who are these people because there is no data of them and this labor are the main workforce they are giving them the livelihood so they need to take care of them. I am sending notice tomorrow to all my both of the charities why I should not stop the activities because when I went there I saw so tomorrow notice will go because this is unacceptable because these are not laborers only these are human beings. But labor department has to be proactive before the fisheries department and the health department. They do but labor are data na कोण कोणाला तो काय मिळणार. So now my final question is I'm asking you sir. आता आमच्या साइडीन 10 जण पॉझिटिव्ह झाले म्हणून म्हाका दोतोरान सांगला. Do you have the record the names of the people who are the working for where are they so please do find out so that we can isolate them. आता bad weather म्हणून हाय ते गेले मागीर ते येवपा नाही. मागीर केन्ना आता फूल म्हणून हाणू त्यांना नावच नाही देन न्हू then they all go on the beach they go anywhere
otherwise the jetty is nobody will be
Two
there.
things I would immediately suggest. They have their fortnightly meetings in the panchayat, Mogor and daily. Let them record this in their regular meeting. It has to go step by step. Secondly, sir has rightly pointed out his limitation and he will keep on pointing out. He is not to be blamed. The labor laws are like that. He has raised the issue of labor. Nothing that he has raised he will able to do because within his labor laws he काय करपा जायना. So what I am suggesting, one minute, let them move a resolution that a special meeting should be convened to discuss this matter with the labor department. See, however enthusiastic he may be, he goes somewhere and says, "तू कोण कित्याक हे जाता? कायदो allowed जाता, तुका हांगा येवपाक विचारपाक म्हणून ना मरे." Must do. This is what inspectors. I am dealing with the labor inspectors at ground level. I know what it is. So there are some difficulties in the labor laws. However, Mr. Livingston Martin has taken the initiative to have a proactive approach of awareness building on all these issues, although they do not come under act and rules. Let us, he says, at least let us create the awareness so that employer, residents, everybody comes to know that it is a human being at the end of the day. Okay. In the meantime, if some amendments have to be made, if Goa government can make some amendment to bring this workforce, give them some assistance, whatever, we work on it. But kida asa, that whole thing roadmap has to be there. Right now, what I am saying in the first, where is your next fortnightly meeting?
It was supposed to be held today.
Okay, so your first fortnight is not over.
No.
Meeting.
No.
Mobile, तुमचे meeting huh? Okay, so in both these meetings, no, you record this in your meeting minutes that and express your concern and you petition the various authorities. Quickly you make the correspondence. See, it has to go step by step. Accordingly, one copy will go to video block development officer will start acting to see under directive of Panchayat Act and rules what can be done, what cannot be done. Doctor will see, we have to ultimately use the acts and rules which are there in our purview. We cannot superimpose something. Sir will also see what can be done. So let us first record this in all the processes that are required. And doctor, I would say please issue notice for the convening of these meetings. if the village health committee meeting is convened in both these panchayats, particularly East Panchayat and Veli, we will see that we attend. Our consumer forum representative is there in the committee. So we know that the meetings are not being held because no notice is coming to us. Once you have this meeting, we will record in the thing and in the minutes to say whatever additional grants have to be given to both these panchayat from DHS, special allocation to conduct this awareness program for next 4 months. Posters have to be printed. Lot of work is there. But tomorrow they will say where is the request. It has to come through proper channels. You know it, protocol wise. So let us do it systematically.
So IEC is one part of it.
One part.
There is some infrastructure.
So they can requisition. No? That's why doctor has to requisition. What type of team you require? Additional, I think you have got help from urban health center.
Yes.
Correct. Dr. Kozrus and his team will not able to give you continuous help. Emergency, okay. So what kind of long-term assistance you require? You propose, no? And we will take it up at district and state level also, no? But unless some correspondence from madam, from panchayat, from health, from labor, everything together, then sir can again then put up to collector. Higher meeting can be called by district collector. See, this is the way forward. And honorable MLA is there. I am sure that if we put up some proposal, he will say, he is not going to say, I will not do anything. The fact that he is sitting here is concerned. So, let us use the good offices of the honorable MLA to take it forward. But unless we place before him, Baba, kide jai? Kide amtam infrastructure jai? All this thing. And sir, this issue of the jetty, I think should be taken up separately. Business department has to tell us, are they going to inaugurate that jetty? Or are they just going to use it as a platform to keep something? Let us not call it a jetty.
They inaugurate also, that jetty is not proper.
Yeah.
That jetty is not proper, new jetty. Trucks and all where they
design
keep.
itself to not work this loaded trucks.
Yes.
There's the trucks and all.
The ministry is not
will
able to answer that, whether it is stability is there or not.
Question had come.
They are not able to answer. So overall they have said we don't take a loaded truck on that. So what is the use of that?
No, but there is no signboard there. If I take a truck, nobody can stop me. That is why I am telling business department has not put. So sir, under disaster management, if that thing collapses, no, it will be a serious disaster. So under disaster management, we have to take up that issue and work out some alternate arrangement. We see, army can be, health can be, you can have that pontoon type of thing. Okay. See, it's not that it is impossible. Army can help also in providing this type of thing, design. Just because we have built something we cannot use, let us not, bang our head on the wall. Let us find a solution. But
Presently now, sir, this is serious concern. As per what Sarpanch told, the Kavalation Sarpanch, first, initially now we have to isolate this, we are affected now. That is the first now, presently. That we'll see, as per as this I think, it spread more, that's why we have to isolate them, we are affected. Now season has started now, season has to go. Before
Some
that,
are already
presently we have to isolate them.
doctor has to say, no, what is the protocol to
Whatever
isolate?
it is, that is whatever to spread more,
Yes.
we have to isolate, we are affected. That we have to do first now, at this situation. That whatever it
No,
is.
let doctor, let
When they
doctor.
are admitted, they are
Whoever may be, whatever, with the help of all the authorities, maybe police, maybe anybody, health, ESI or labor, first we have to isolate and keep whoever may be. That is loader, or it is on the working on the boat. This present situation, we have to do this first. To diffuse this, first we have to do whatever with the help
No,
of.
they are already moved out now. Affected people are moved out. आता problem किती असा जो तो
This is the 10.
Sir,
Who are there? Who will
See,
be
I'll tell you, sir, each party got.
minimum who are there?
We are not against the.
Nobody is against.
What I am trying to tell you
Sir,
is,
so we suppose we are not identifying others, no, that will remain continuous.
Some of them are sent
Nandini
home
Asa,
also
wait,
back.
wait, see, what is the source? Yeah, Udik, the people who are serving the food, no, so that is what I am saying. We have to fix up when FDA will do their inspections of all the food outlets there. See, problem here is that how the infection will go on spreading. If the food handlers are not taken care of, they are not wearing the gloves, they are, the cleanliness is not there. So they are पहिले तपास आहे ना, ते आम्ही डेट deposit.
FDA has to act.
Yeah, so FDA has to check.
Every-
FDI आपण डेट देतात ते बंद करताय. ते from bond inspection करपाक येता सिरू पण उडे
Yeah, that is there.
See,
ते
that
bond
is,
करता न्यूज मेळ्ळा ते bond करता
That should not be done.
आनी ते inspection जायना
FDA
जायना ते
inspection
समका
करून
सिरू
येयले.
मला बंद कर ते चेकिंग करपाक दिना जाल्यार
sir, when we go
Not
for,
limited
also same thing. They close it.
कोण ना कोण कितें वयता तांकां पयलीं रिकॉर्ड आसपाना पंचायता कडेन कितें वेस्ट जाय
The cholera virus.
No, he get change करना तो register करना है.
We, as per disaster management act, we have to do,
So
we
it
give the
handlers are
protection. We have to
touching
stop
eyes
us,
ना ते बंद करता ते पयलीं
Yeah,
गांवांत
but
गांवांत
FDA
disaster, we
No,
give
no,
the
no,
protection.
so.
FDA inspection they did. FDA did
So
it.
sir, what I would request, let us look how the food arrangements are there. Now the people who are going on the boats, what is their food arrangement? They are cooking on the boats. So can FDA check the cooking system that is being used on the boats? Because if infection is spreading on the boat, we cannot control it. No? So we require FDA to do their inspection and give the report. Doctor is giving, and therefore let us have also fix this time frame. See, today is the 4th, correct? So next 10 days or next up to 15 September, what we are going to do, and from 15 September to 30th September, what we are going to do. So let us fix that up.
What about the toilets and all? That is of major concern. No?
So they can put in a request now for additional toilets. So mobile toilets are available. They have to spend money. Mobile toilet are possible.
Why mobile?
Toilets are there. Digester, electricity digester. They brought.
Yeah,
Yeah, but they didn't
No,
open.
permanent toilet you have to build now.
No,
So no, that's what we are telling them now.
They
Already
open
the point,
all night.
already that point is there.
No.
See,
Toilet I think
therefore,
but they
are you
didn't.
able to tell those toilets are working? What is happening? You have got an agreement with Sulabh.
Nothing.
Any written agreement is there with Sulabh? That is important.
think it
See,
problem
if
also
I
negative.
call them and there is no agreement, it doesn't. Do you have any
There is
writing?
August bata police verification na touchstone घरा रहता है immediately I would request you all the boat owners who are registered, let them get a list of label employed in this year 24-25. That is important to kata पढ़ाने तो काय होगा ना.
Sir, here I tell you from labor perspective. So when we say Interstate Migrant Workmen Act is not applicable there is requirement of one contract is there. Then only that act is applicable. So for fishing community, what is the problem? This we are discussing several times. The data, whenever that boat is registered with the fisheries department, even the workers there earlier they used to give the cards. I think what I have been told by them now that the central ministry has told them to maintain a card, that is a Aadhaar card with that with QR code. So that data is with them. So our problem is that they are not working on the land. There is no who is the employer to be counted. Which act should be? If my inspector goes there what Mr. Roland pointed is very clear. He'll say under what provisions of the law you are coming to me. So our role is very limited to that. Got it? But definitely the workers registration, I think they are having a data, because last time when we went for unorganized things, we were in contact with fisheries department. They said around 4,000 to 5,000 people are coming. When we went for some from unorganized and Eastern card restrictions, there was something that we were not there.
But every year they are changing.
Just 1 minute.
Yeah.
So that is a problem. But they are having a data. When we are discussing about data, I think they are having it. No? तुमच्याकडे असतात मी आता ज्यांना तो बोट ओनर्स आता सीझन स्टार्ट झाला की तुमका लिस्ट देतात तुमका कार्ड देतात हां सो बट एनरोल करून घेतात म्हणजे तुमच्याकडे खबर असा XYZ बोट सो दे आर ही इज हॅविंग 25 people correct you are having it so that is what data is there with them so when the sarpanch said we have to maintain a data we when the laws are not applicable we cannot do anything. There should be applicability of law should be there. Interstate should be there or the minimum wages should be applicable to them. So that is there. So here when we say about sanitation all these things, if we have to penalize the employer, then there should be employee that they should be covered under that legislation. Then only it is possible. That's our issues are there. So every time what is happening, labor means he is covered. It is not like that.
No, there is a presumption in the mind of the general public.
So,
I disagree.
so what is happening, you know?
Sir, I disagree.
No.
I disagree.
No. So please go through that, or you can come to my office. I show you what are the provisions of the law.
See, That
What
is
are
why
the
I one
See,
minute, one
that's
minute.
what we are
Definitely
talking.
you will have covered them.
Sir, what we are talking here for a solution is.
No. Solution, I told you one thing.
Can I suggest
No,
therefore?
yes,
One
sir,
minute.
one minute.
Both
So data is there, and that is with the fisheries department. I think with that data, all the concerned departments can work out. So let them give it to them. No, that this
What
he is a boat owner. He is having so much of number of workers. So from here it needs to be started. When we say preventive measures. So my inspector also told me one thing. One second. My inspector told me something. Because these people are coming from other states, correct? So who knows that he comes with the dengue here? So is there a primary checkup? Is there? No. So they are just taking their Aadhaar card with the QR code, correct? So after that there should have been checkup. So now here the nodal department, you see, that jetty is the custodian of that jetty, or the authority is fisheries department. So where we are who can enter there? We cannot enter there. We cannot do anything there. If anything we have to do, we have to request the fisheries department. So point of view is like this, that it starts from the fisheries department. They give a QR code and they are giving the details. That time I think if some solution needs to be resolved, that yes, from there only, yes, their checkup should happen at the first stage only. Just like that now, sir said about building construction, we have inspected all the sites now. Almost all, everything is covered, and my inspector is also directing them to see that those health cards are issued. Correct? And whenever the health authorities are coming, joint inspections are conducted. Those who are defaulters, we are filing a charge sheet against them. It is already started.
So
there is
what
no issues with
I
that.
think we
Point
need
of
to
view
do
is that from
is
there it should be
fisheries
started.
department needs to tell us, sir, you are full time at the jetty, full time or you are sharing? Huh? Full time at Cutbona Jetty, correct? Madam, where are you located?
I'm at Kolba.
At Kolba. So, in the present setup that you have, can you manage this? Do you need additional staff? So put up the request. No? See, I know when you are saying I have to put request, you are considering your own department and all that. See, here we are looking at the requirements of everybody. It is nothing personal of this department. If your director says we don't have enough staff, we have to recruit or whatever, let us do it. Honorable MLA also can intervene. But we need to know what are the requirements. You understood? In terms of infrastructure, about cleaning. Okay, toilet, we'll make assessment. After 1 week, let us see what more additional toilets are required. If those toilets are not functioning, what is the reason for one thing? If Sulabh agreement is not made, let us make the agreement. So, we have to put pen and to paper and prepare a roadmap. But it has to be with everybody's involvement. That's why I am requesting also Panchayat. See, we would like him to do some magic with his labor department. You take a resolution that labor department law should be suitably modified. You take a resolution. Let it go where it has to go. When it will happen, we will see. But unless we express our desire, nothing will change. See, we may expect him to do many things. He is expected to do many things. His hands are then limitations. So, doctor, in terms of now, today's position, what is the state of infections as of today? Are we having still people?
There are diarrhea cases.
So diarrhea cases mean they are staying there or they have moved out?
No, moved out in the sense.
See, are they still there in that
If they
area?
have mild infection, we give them ORS and they give them the medication also. But if they are like yesterday, sister told me, I have not got the names. 2 people were referred to South Goa District Hospital.
No. So let us have that. Let us see that you prepare a list and monitor them, no, their condition. And if you say 10, 20, 30, then we have to see that we are dealing only with that number. 30 should not become 50. That is the point. And that's what sir was raising. That
So that is our concern also. So our main thing is hand washing, personal hygiene, because if that is done, it doesn't spread to another person. I may live with a person with cholera in the same house.
yes.
But if my hygienic measures are done properly, it will not
So
spread.
these hygienic measures have to be done on the boats, no?
Exactly.
So what I am saying, can we organize a program there?
I've already had for the boat owners, 2 occasions I have spoken
No,
to them.
boat owners will
No,
not.
because they have been conveyed to the crew. We have had to the crew also.
We
See,
require-
both
we
the
require-
owners, you know, for their labor, everything,
No, sir.
health
We have had for
So
the
here
crew
is a
also.
They
point of
already
view,
know.
We cannot
that
get all
boat
the
owner-
No.
Boat
What I am
owners,
saying,
suppose they know.
let us have it in batches.
Yeah. we
Okay.
had for the crew.
So, no, crew of how many boats we
Yeah,
are talking
exactly.
about?
We cannot cover all the
No, how many boats we are talking about? Do you have a number of the boats?
No,
fisheries.
So that is important, no? See, doctor, if you do not get the, see, you require the data from fisheries department, so when can you tell how many boats
So
are there?
in fact, I
By
can add
tomorrow,
on the group.
how many boats are there?
Sir, here main accountability.
And you divide it.
by the boat
See,
owners.
No,
Yeah,
I-
boat owners.
I asked,
So we
I
are
was
keeping
messaging
that.
them and I've been
Boat
adding
owners
them.
should be made accountable, then everything will fall in line.
You have to put in
Very
I
writing.
put an advisory for
Boat
them.
owners
You have to
first
put your
year
requirement in writing, doctor.
No, what I'm
See,
saying
why
is-
we have issued you notice? We have issued you notice on second to our site inspection. From us, it is a notice to you. If you don't want, we will go step further. We have, even we didn't, we put a letter asking for this meeting. Why? Because we know what, with chief secretary and health secretary, what matters. Ultimately, it is what is in the file. I may tell you, you may tell me verbally many things. That is why I am asking for the minutes for what reason. Because I am telling you, in the management committee, are there no board owners representative? Correct? They are signing on the minutes. Tell me one thing. You can ask the board owners who have signed on the minutes, who has prepared the minutes, how many of their points have come. I have gone to the joint management, jetty management committee in the past. See, when you sign minutes, you are party to that. म्हणून माझे request किती आसा? There are societies there, correct? 3 societies are there?
Two.
Or 2 now?
There are
Three
societies.
3 societies. Yes.
With one federation.
Yes. So these societies, sir, these are societies. Boat owners are societies. So we have to convene a meeting of their these body members as a society. Yeah. And these instructions have to be given. A panel can be arranged of all these directions to be given to them. See, they are societies. And then they are individual owners. So as a society, boat owners society, this has to be communicated officially to them. That is why in our letter we had requested, and if possible a separate meeting should be called with them of the 3 societies and say, you tell us what kind of assistance you want from the administrator.
Sir,
And along with fisheries department is required.
Yes. Fisheries department, everybody, with the boat owners societies.
Workforce is brought by boat owners. And they are equally accountable for that. This accountability is not happening. Only a starting point is happening that they are giving the
There are
other
big-
card copy to
there
them.
are big
That is
loopholes.
finished.
No, the problem is
Otherwise,
there are loopholes.
you see, they are bringing for their business, sir.
Question,
This
Mr.
is
Joel,
the
and I got
biggest
added
question
in the
here.
WhatsApp
Where is
group
their
for
accountability?
and put an advisory
So
for
they
the
have
workers
to be
done.
made
Because
accountable
they
in
are
this
not
case.
taken
You see,
every report.
workers he has brought, he is not accountable
For the last 15 years we are dealing with advisories.
responsibility.
See, advisories on vector borne diseases we are issuing every year.
No, but
Now
that-
we relevant.
Ultimately, it is one-to-one communication and convincing the person, Baba pay. एक तो 6 झालो तुझ्या बोटीचे काम डिले जाता. The business is getting affected, no? So if you do everything properly, business also will run. See, one worker not being able to work is a loss for that boat owner, correct? So we have to talk to them that way.
And we
See.
have to ask them, no, excuse me, we have to ask them because
Mr.
see,
Joel, we've
doctor,
had 2 meetings for them.
doctor.
No, with whom you have
With
had?
the boat owners also. But not
See.
everybody has
See,
staff. That is a
boat owners is one thing. Boat owner doesn't go on the boat.
along with the
Who is the person who is the in charge
Mukadam.
on the boat? Like how you have Mukadam. On the boat, who is the person in charge? We need that person. Whether he is from Jharkhand, whether he is from Orissa, whether he is from Bihar, we need to know that, no? Because that is the communication we have to do. Jharkhand's language is very different. We have to understand. They speak Sadri. Are we communicating with them with Sadri?
Most of them speak Hindi.
Sir, any conditions can be put by fisheries because any of the license is given by the fisheries department to them. Just like now, health are issuing, all conditions are put. When the copies are comes to us, when we are also issuing, we are sending the copies to the concerned authority. There is a precondition. When Panchayat is issuing NOC, there is a precondition. These are the conditions. So now when they issue, there should be some preconditions
So-
because they are taking a boat
It is not
license.
there
You see,
as it is done
boat
for
license is taken. But along with the board, again the workforce comes, no? Because they only are bringing it. So they are accountable for that. So is there some accountability is required to be fixed? So I think it needs to be done from the concerned model department who handles that thing. They are the issuing authority. So if those conditions are put, definitely they have to follow. If they are not following, there can be action. So what is happening? They are bringing the workforce. Now it is only one contact point is fisheries department. Nowhere health department is concerned. All other departments are not nowhere in the loop.
What are the containment measures which we can do?
No,
Any
first,
immediate
first,
measures?
I think doctor should tell us for the next till say Monday. I would suggest if we can try and do that site inspection on Monday. Okay, at the earliest Monday. So when we go there, we can then map out everything. Okay, so between now and Monday, what additional cases are there? Can you have a reporting system? Every day you see if there are new cases are reported or whatever.
In the morning time, I have my staff over there
Yes.
sitting in that room, so
Okay.
they're supposed to come there.
Can you put a WhatsApp number there that suppose somebody gets sick or something, he can call that number. See, now we have to go beyond your staff. See, from 9 in the night to 9 in the morning, in that 12 hours if something happens, who should they should contact? So put a number, no? Some 2-3 numbers they can, hospital or whatever. Because these workers can contact. See, some of them try to do self-medication. They will just wrap themselves up and just, because of fever or whatever it is. So, 1 or 2 WhatsApp numbers if you can put there. In case of emergency, to call. Okay? And then from 9 to 9, what is the arrangement? Because you have a duty time. Night time, we don't have anybody there. Correct? So, we are on Wednesday, Thursday, Friday, Saturday, Sunday. Ganesh is there Saturday, Sunday. So, at least Monday, let us have the site inspection. If it is, if everybody agrees, we go there and see what is the thing, and based on that, sir, we mark what are the requirements. Whether it's water, whether it's toilets, whatever it is, we mark and straight away finalize who has to do what.
Sir, what is important is accountability, and I think when we go on Monday, you will not find anybody there, because they are at sea. You have to go there when they come back.
No, we are not going there. No, we are not going to check them.
No, sir,
We are
sir,
checking the
sir,
He
infrastructure.
has pointed out a clear thing, you see,
Otherwise, sir-
unless he is employer, boat owner,
Exactly.
brings them,
Now what
never
happen-
happen. That's why I'm
otherwise-
saying, the contact point is the nodal department where
Sir,
from that the
And boat
instruction
owners
is
know they are
Sir,
not
boat owners
responsible.
Now,
needs to
how
be
the
put
police
in-
are doing?
put in
If
order
police
and
not
that
taking
verification
any
is not
responsibility.
if police verification is not done, then they held the owner. Same thing should happen there.
Yeah.
You give them time, within 2 weeks, you get all the other card, register on each boat who are registered in Cutbona. So that is the first thing. In identify government, आपल्याला नोच म्हणताय.
Yeah.
Issue is that we don't know. तो कोणाला गेलो?
आता फिशरीज कडेन डेटा सांगले फॉलोड बाय they must get
Yeah,
data.
having a
Every
data
year they are
Okay.
changing.
Let
Every
me
year
just
same
clarify.
workers are not
The
coming.
purpose,
but every year they are giving
Sir,
that
sir,
data.
one minute. The purpose of the site inspection is not to deal with human beings. Purpose of the site inspection is to look at the fisheries complex, look at the jetty, look at the infrastructure, and based on that, put up our notice on the infrastructure. That is the first part. This thing of holding the awareness camps with the board owners, etc., that is the ongoing thing. Site inspection is to see if the toilets are there, that pollution control board person to be present there, Sulabh person should be present there. On the spot we will verify, has he taken charge of those toilets? Okay, because all the Margao toilets they are dealing with. They have renovated, everything has been done. So, Sulabh, pollution control board, okay, FDA. So let them come, even if the shops are closed, there is no problem. We will photograph it, we will clearly see how many shops are there and record the data. See, ultimately it is about infrastructure.
Roland, we also
FDA
require
had given
some-
notices and
No, so if there is any role with PWD,
Excise also we need to.
yeah, excise, PWD have to be called for the inspection. Okay? So that they, if there are some bars operating, then legal bars also, they have to give them notice about hand